creating this in an entire package while reducing the cost as well is so beneficial.
Everything fits in this tiny box. So it comes with consumables as well, such as the hats, the nasal prongs, different sizes of nasal prongs, the different weights of the premature babies as well that we born. The safety pin, the rubber band, all just
I think it would be also good to train the people in the various facilities and probably provide the gadgets so that they can always continuously monitor for the positive evaluation.
I think just to elaborate on the issue of cost, the implication that kills the need for electricity, I assume.
the electricity is the main thing, because we're living in on a continent where access to electricity with such basic things such as oxygen.
Our first patient was 900 grams.
Wow.
Yeah, and the baby, we were actually able to wean off the baby of CPAP. We are currently using it on a 2.0.
It's connected to your expirator. So you do take certain measures in place to reduce the risk of infection at any hospital. And then because you're pulling in ambient air from the outside as well, there's a filter that's included, a bacterial and viral filter. And then all of the consumables, so the hats, the mustache, all of that are provided different sizes to cater for different sizes of the premature babies as well. And all of this is provided with the kit, so you don't need to go looking somewhere else.
By the next day, we had started weaning off the FiO2s, the concentration of oxygen, and clinically, the patient actually started improving. And that was very obvious
So this is known as the Vayu bubble CPAP system. It is actually the world's first and only infant CPAP system that is able to provide a blend of air and oxygen to the neonate or to the baby without the use of any electricity whatsoever. We already have existing CPAPs on the market, but they all use some sort of electricity. They're very expensive, they're not easily accessible, the consumables and accessories are hard to find as well. And so because of these reasons, approximately 90% of newborns are left without any CPAP support. And over 1 million babies die each year because of the need for respiratory support that they're not getting. So us, Revital, as a local manufacturer, we want to come in and address this challenge, where we're able to provide oxygen to these premature infants and do so without the use of any electricity. So how does this device work? All that it requires is a source of oxygen. So when oxygen is flowing through the entire system, it flows through the blender, which is where the magic happens. It blends in pure oxygen with oxygen from the outside air as well. And you can adjust the concentration between 30% to 100% before it reaches the patient. But why the Vayu bubble CPAP? What makes this device so special? Because we do have existing CPAPs on the market already. But now you've personally seen this device work, how this innovation works. And before this, all of the CPAPs that were on the market were out of reach for majority of the newborns because they're too expensive, they're too complicated to use, they require maintenance, and most importantly, they require electricity. Our continent as a nation, we cannot always rely on electricity for the provision of the most basic thing, which is oxygen. But now we can. And why? Because we have this amazing innovation, the Vayu bubble CPAP, that is able to provide oxygen to these babies that need it, but it does so without any electricity whatsoever. So with this beautiful, small, portable, reusable device, we're able to overcome this great challenge related to oxygen access and respiratory support, and most importantly, provide hope to the families out there that yes, your baby is going to survive, is going to grow, be happy and be healthy. So just to highlight a few interesting stories which I had mentioned inside, This device was actually used to save a baby in a tuk-tuk. And the baby was transported from a level 1 clinic to a level 5 clinic over 200 kilometers away, but in a tuk-tuk. And this was possible because this device, you can move it around that way. It's portable, and all that it requires is the oxygen source. So you could essentially use it in a level 1 facility, in ambulances, in clinics worldwide. I mean, these newborns, they're our future leaders, and we must focus on doing everything that we possibly can to support their little lungs and to make sure that their every breath counts. Thank you.
In 1 year, our newborn units that admit babies who are born with very low scores, they admit over 1,000 cases annually. And unfortunately, sometimes we lose up to 40% of those babies that are undergoing certain complications. And when we look at the data, the top 3 causes of those deaths are related to oxygen concentration deficiency in those babies. So whether it is asphyxia, whether it is respiratory complications and distress, whether it is about general complications that come with prematurity, but the first top interrelated causes touch on oxygen level deficiencies.
As at 2018, only 22 facilities in Kenya were using CPAP to improve newborn outcomes, since initial acquisition costs are quite high. This is why the majority of the facilities use such donor-funded machines. In Kisumu, I'm informed that we only have 5 machines, which are in the largest referral hospital, leaving out the county and the sub-county hospitals. So the 5 machines are concentrated at Jaramogi Odinga Teaching and Referral Hospital, and even then, they're not enough for the babies that are being born every day who need this service. So when we're here today, I believe that there's a huge opportunity to increase the number of these machines, especially using locally made, cost-effective technology to improve the outcomes of newborns who are admitted so that they can have a chance to survive.
As a neonatologist, I have to say that neonatal mortality, which is defined as death of a baby in the first 28 days of life, remains a significant public health problem worldwide and accounts for approximately 60% of newborn deaths in low and middle income countries. The leading causes of mortality are complications of prematurity, infections, and asphyxia, and difficulty in breathing in these neonates is a complication which is common to all of these 3 conditions. So CPAP, which is continuous positive airway pressure, is a non-invasive respiratory support that provides continuous level of positive pressure, improving breathing. We have been very comfortable knowing that we are giving blended air to these neonates instead of just giving pure oxygen. And we know that we are actually managing these babies, and by giving the blended air support, we are reducing the risk of complications like retinopathy of prematurity and chronic lung disease. Going forward, I would like to recommend this machine to be rolled out in facilities countrywide. And I would also like to recommend that ambulances, especially from lower level facilities, be equipped with these machines, especially when it comes to transporting preterm neonates. Thank you.
And I am a practicing emergency physician at the Massachusetts General Hospital in
the few speeches with the prayers, Oliver and Zekaindi. Revital Healthcare, which is known as the Vayu Bubble Continuous Positive Airway Pressure Device. We've got several dignitaries who have come from Coast General Hospital. Say a few words, please. She's, by the way, Dr. Nair from Coast General Hospital.
Can I say we at Coast General and Mombasa, thank you so much.